Thank you very much, Mayor. Unfortunately, we are seeing increases in the coronavirus cases in the Philadelphia region. I'm going to summarize where we are with that. Then I'm going to update you on our contact tracing work. And then I'm going to discuss our response to this increase in cases. First, though, the numbers. Since this time yesterday, we've identified 142 cases of the coronavirus infection in Philadelphia residents, bringing us to a total of 29,945 since the beginning of the epidemic. Now, in the past week that ended last Saturday, July 25th, we averaged 164 cases per day, so high case counts throughout the week. That's up from 141 cases per day the week before that, and 111 cases per day the week before that. Now, with lags in reporting, that 164 per day will likely increase in the next few days when we get the stragglers of cases reported. But you can see the overall increase. Now, the increase is partly related to increase in testing. We tested more than 3,100 people per day in the past week. That's up from 2,100 people per day 2 weeks earlier. The percent of people who tested that were positive was 5.2% last week. And that's pretty consistent with where we've been. We've been between 5 and 6% over the last month or so. But still, there's no denying that there's a significantly increased trend in cases across the city. And if you look at the graph on our website, you can see that. Now, those new cases are still predominantly younger adults. 36% of the cases I'm reporting today are under the age of 30, and 51% are under the age of 40. Now, we are also seeing small increases in the number of people who are coming to our hospital emergency departments with symptoms like fever or cough that may be characteristic of COVID infection. It's another marker of increased viral activity in the city. We're not seeing an increase in the number of people who are hospital inpatients yet, but we're going to be watching that very closely. Since this time yesterday, we've reported 0 new deaths. That's good, bringing us to a total of 1,678 deaths since the beginning of the epidemic, of which 855 or 51% were nursing home residents. Now, across this region, we are seeing case counts rising everywhere. They're rising in Bucks County, Delaware County, Chester County, and Montgomery counties. Interestingly, across the rest of the country, the epidemic, which has been surging, is now stabilizing. Daily case counts in the U.S. as a whole have been flat for the past week, and daily case counts have been falling in some states that were the earliest surges in this second wave, specifically Arizona, Texas, and even Florida. So in summary, this second wave of the epidemic has now reached Philadelphia. Our case counts are not rising nearly as fast as the first wave that we saw in March. Nonetheless, this represents a period of genuine risk that the epidemic is likely to be worse before it gets better. Now I'd like to fill in where we are with contact tracing and then come back to our response to that increase. First, I want to remind people what the process for contact tracing is. What we do is we get the names of people who have COVID infection from laboratory test results. The laboratories report those tests to us. Find the phone number for the person who had the infection, and then we call and interview the person that's who's infected, that we call the case. We ask that case to isolate so that they don't infect other people if they're still infectious. And we ask that case to give us the names of their contacts. By contacts, we're talking about people who have spent more than 15 minutes with them within 6 feet. We then call those contacts and we ask those contacts to quarantine for 14 days so that if they were to develop the infection, they don't in turn pass that infection on to other people, so that we can try to stop the chain of transmission. During those 14 days that the contacts are in quarantine, we ask them to monitor for symptoms, to take their temperature every day, and to answer text messages that we send them every day about their status. Now that process involves interviewing hundreds of cases, requires managing very large amount of information, and there's a lot of communication with many people as part of it. It requires the cases and the contacts to voluntarily cooperate with us. And that requires their trust. And that in turn requires our having staff that have strong interpersonal skills, the sort of people that you would trust. And it's a large workload involved in this process. And so to do this, we built a new division within the Philadelphia Department of Public Health. I'll tell you where we are with that, building that division. We've now hired 108 case interviewers, contact tracers, and supervisors. Most of them are actively working, though some of them have just been working for about a week. Some of them are still in training. Now, Philadelphia is a very diverse city, and the people who are affected by COVID are diverse. As we just had in a hearing this morning, much higher rates in African Americans than Caucasians. And so we recruited local people to specifically by sending notices to to local organizations that were serving neighborhoods that were high risk for the infection so that we could get a diverse staff pool. We also posted our jobs online in 4 different languages. And we hired a very diverse group of people to do this work. Of the people we've hired so far, our most updated numbers, 57% are African American, 25% are white, 6% are Latino, 11% are Asian. And of those, of the total, 16% were born outside the United States, and 35% report speaking a language other than English. Now, our contact tracers have now been divided up into 5 different teams, and one entire team is the Spanish-speaking team so that we can deal with many Spanish-speaking people in the city of Philadelphia. Now, many people have a view of government workers as somehow some kind of bureaucrat. We want people in Philadelphia to understand who the people are who are doing this work, how human they are and how they're doing this out of sense of real service to others. So we're posting a video on our website today. It's highlighting 4 of our contact tracers. People get a sense for who it is that's going to be doing this work. So that's with our infrastructure. Now, what's the outcome of the process? Well, this group is reaching now hundreds of people per week with these interviews. But they're finding, as with the contact tracing that we've done in the past for sexually transmitted diseases and for tuberculosis, finding that the process is not easy. So from Sunday to Friday of last week, this group attempted to reach 613 cases for which we had phone numbers. 55% of those people completed the interview, 6% refused the interview, and 38% we haven't been able to reach yet. Now, of people that we interviewed, about a third reported no contacts. It's either said they didn't expose anybody, or they couldn't name those that they might have exposed. Of those who were reporting contacts, we averaged 2.7 contacts per case. And of those contacts, the ones we're calling now, so far we've reached 73% of them. Now, this is just the beginning. We're working to improve all those numbers. We're going to be tapping into additional databases to get missing phone numbers. Additional staff will be going through training, and all of our staff's skills will improve with more experience. We also really want to reach out to Philadelphia residents and get them to cooperate with this process. So we will be doing a media campaign that encourages people to participate. We want everyone to help. There's no downside to working with the contact tracing team. Participating means helping other people, and it can be life-saving. And for cases and contacts who need support to isolate and quarantine, there may be some people really have difficulty doing that. We will, in the future, be able to provide that support. We will be setting up contracts with organizations that can provide the kind of assistance, such as delivering food or delivering medicines, so that people can stay home, so they don't pass the infection on to others. There is a request for proposals on our website for any organization that wants to be able to provide that kind of support. They can apply for funding to do that. Now, besides benefit to individuals, the contact tracing process helps us in the health department better understand how the virus is spreading in Philadelphia so that we can tailor our overall response better. The interviews on cases give us information on some key things about that. I want to give you a little information of what we're learning from our interviews. First, on travel, we're seeing that 27% of our cases traveled out of state during a time when they might have been infected. Most common travel site, beaches in New Jersey. Now, I don't think that they're getting the infection when they're actually swimming at the beach, but when they go to the beach, they're likely to be participating in social events, and they may be traveling in cars with other people where there's exposure during the travel. We've also seen that 15% have traveled to other counties within Pennsylvania outside of Philadelphia County. We also learned about how many people know that they've been exposed to someone else who has the coronavirus infection. 48% of the cases we interviewed knew that they were exposed to someone else with COVID infection. And of those, 36%, the COVID case that they were exposed to was a household member. 18%, it was somebody that they visited when they went to another household, or some visitor from another household that came to theirs, typically a relative. 14% said that they knew they were exposed in social events, particularly social events with relatives or friends, and 12% said they were exposed to another COVID case at the workplace. So the message of all this to me is that recognized exposure is common. Many people actually know that they're exposed to this infection, and the most common source is people's relatives. And that's useful lessons for all of us in prevention. So getting back to the overall increase in Philadelphia, why is it that we're seeing this now? I think that there are 2 things going on at one time. First of all, the second wave has simply hit us right now. To a certain extent, epidemics like this work in waves that travel geographically. Between March and May, there was an epidemic wave that more or less started in New York City and that spread south and west and hit Philadelphia on the way. Then, after southern states reopened too quickly and too recklessly, there's a second wave that started there and then is spreading north and east from there And that wave has now just arrived in Philadelphia. Second reason is that people are exposed to relatives with this infection, and they're exposed at social events. People, it appears, tend to follow safety guidelines when they're at work, when they're shopping, and when they're around strangers. But we all tend to trust our relatives and our friends. And so those are times when people neglect the use of masks or neglect the distance from people, even if they're sick. So with that in mind, what's our response to this increase in cases? First, we want to reiterate a recommendation that people not travel to the beach. Again, it's not swimming that puts the risk there, but it's the socializing that occurs at beach trips that puts people at risk. Second, we're recommending that people avoid social gatherings, including social gatherings with your relatives. Now, we are prohibiting gatherings of more than 25 people indoors, more than 50 people outdoors, and we'll continue to do that. But you can have infection spread in gatherings that involve 5 people or 10 people. So we recommend that people not participate in gatherings of any size. And we're recommending that when you are around your relatives, wear a mask. You should trust your relatives in general, but not with COVID. Your relatives are no less likely to have infection than strangers. Anybody can have this infection and not know it. You should assume that anybody that you're around has the infection, and then assume that you have the infection and don't know it, and act accordingly. Then remind people, if you have symptoms, such as a new onset of cough or fever, stay away from everyone, including your relatives. You don't want to pass the infection on to them. Now, we are already prohibiting indoor dining at restaurants. And in view of this increase in cases that we're seeing now, we're going to extend the date of that prohibition for indoor dining to September 1st. That's because indoor dining is inherently risky. People are indoors where we know the risk is greater, and people are not wearing masks because they're eating and drinking. There have been clusters in restaurants that have occurred across the country and in other counties in Pennsylvania. Now, we're not seeing clusters occurring in Philadelphia involving spread in restaurants, but then again, we haven't allowed indoor dining here either. We don't want to see the second wave to be as big as the Florida's. So that's where we are with this epidemic second wave. If you want to see more information about our contact tracing or about the epidemic overall, let's go to our website, www.phila.gov/COVID. Thank you.
Thank you, Doctor. Let's start off now first with Jacqueline Lee of 6 ABC.
Hey there, can you guys address concerns now that 17 Marlins players have tested positive? Could they have spread COVID to other Philadelphians? Does that seem likely? Can you talk a little bit more about that?
So my understanding is that the team has very little contact with Philadelphia residents, though some. We have been guiding the Marlins, and they're going to be doing contact tracing to see if there's any Philadelphia residents that they may have exposed that need to go into quarantine. I would say overall the risk to Philadelphia residents from this is small. The greater issue, though, is that the Major League Baseball had a very thorough safety protocol that should have prevented this from occurring. And so I think that Major League Baseball and the Marlins specifically need to understand exactly how this happened. If people were following that protocol, you wouldn't have expected to see this many cases. And so they need to figure out where that occurred, and so they don't have further spread on this team or other teams have similar spread.
Are you guys including the Marlins players in your case count for here in Philly?
We don't, because we're just counting Philadelphia residents.
Gotcha. Okay. So the Phillies are planning on going to New York at the end of the week. They just interacted with now 17 players who tested positive. You said we're now going through a second wave. So do you think this could create, a bigger risk? Like, should baseball be canceled because now there's all this traveling and all these players who are testing positive? Like, what are your thoughts on that?
And this definitely is something that the league should look at, and we will, talk to them about this. Again, they have some very tight safety protocols that should have prevented this from happening. So I think they need to understand better how it occurred and talk about how they can prevent this from occurring in the future. As far as the Phillies specifically, there can be a delay between when you're exposed and when you develop the infection. And so they'll need to be testing those players that might have been exposed to the Marlins for a few days to see whether they may have gotten the infection. And if they had significant exposure, then they should be quarantined and not around any other people for 14 days.
Last question. Do you have any updates on the situation? Like, I was told that the teams have to tell you guys if there's any confirmed community spread since they're the ones doing the contact tracing. Like, do you have any update on the situation?
So a member of my staff is in contact with them. I've not heard of any case in a local person as a result of contact with the Marlins team. I understand that there were additional Marlins that were testing positive today. You may know more than me exactly the recent case count with the Marlins.
Thank you.
Very good. And thank you, Jacqueline. Let's go now to Dania Henniger of Billy Penn.
Thanks, Mike. Dr. Farley, can you address privacy concerns regarding the contact tracing? I mean, I imagine you have some kind of protocols there, but just so that we can explain to people, you know, when you have their numbers and you get all their friends, like what are you doing with this information and how are you keeping it safe?
Yeah, so thanks for asking that question because that really is important. The information we have doesn't go anywhere. It's very much protected legally. So any information people give us just stays within the health department. Then when a case tells us about their contacts, and let's say there's 5 people that they think we may have exposed, when we go to those contacts, we simply tell those contacts, you may have been exposed to someone with COVID, you need to go into quarantine. We don't say the name of the person who gave us that information. They may ask, they may guess, and sometimes they may guess correctly, but we never give the name out of the case when we're talking to contacts.
Okay, and you already have tons of health data. It's not like we should be worried about you keeping health data safe, right? You already have that, I guess.
Correct. The health department receives information mandatorily for infectious diseases, and we've done this for 100 years, and there are a lot of legal protections. So we have information on everybody with any reportable infectious disease in our databases. We never give that out.
And the people who are working as the tracers, they go through some kind of training about this specifically?
Absolutely. Confidentiality training is part of this, and it is an extremely strong part of the training, how they operate.
Thank you. That's it for me.
Thank you, Tanya. Let's go now to Mike Donofrio of the Tribune.
Myself. All right. So maybe just on the topic of indoor dining, you know, what's the administration's message, I guess, to restaurant owners who are probably making plans to reopen this weekend? You know, bought supplies, bought food, might be contacted some of their employees to come back. You know, they were getting ready and now it's delayed once again. What's your message to restaurant owners?
Well, you know, first of all, I have real sympathy for restaurant owners. They've really taken a big hit in this epidemic, and it's I appreciate that it's tough for them. It's sad that they can't open right away. However, the risk is great if they open indoor dining. I simply say that we knew that it was always a possibility, not a definite, that we were going to open on August 1st. And as case counts are rising, it really looks like it is a definite that they can't open on August 1st. The things don't look good right now. I think it's better for them to not open than to open and have to turn around and shut down again a week or two later.
Right. And obviously, you didn't put any new restrictions in for gyms or casinos, museums, libraries, things like that. How is that going? I remember a couple of weeks ago you said you started doing random check-ins at gyms. Can you provide any updates on that?
Right. We are doing inspections of gyms. The last numbers I have is that we've inspected 13 gyms. None of those 13 gyms were shut down. There was one gym where one person was found not wearing a mask. That gym was given a warning. So far, so good with the gyms. And we have not had any reports of spread that we've learned about through our contact tracing in gyms. And the larger point, though, as I just mentioned earlier, is that there seems to be, it's uncommon for someone to report during a contact tracing that their exposures seem to be at the workplace. So workplaces in general are not the major problem right now.
Of CS3.
So just a couple questions today. I know you, Dr. Farley, you said that the folks from the MLB were handling the contact tracing. My question is, with our contact tracing apparatus here in the city up and running, there's no government function or interaction with that. We had a very hard time trying to find just what we thought was public safety information about, hey, where these players were, where they are right now, and who they might have been exposed to. As a resident, you know, I think it's a bit concerning that we can't get that.
I would simply say that a member of my staff has been in close contact with the teams involved, and she told me she thought they were doing a good job with contact tracing, and they're giving her regular updates. If it got to a point where we thought that they were not doing a good job, we would step in and say, okay, we need to do the work ourselves. At the moment, we feel like they are.
So with the team being responsible, that's the Marlins or the Phillies being responsible for contact tracing, if you can make that clear. And how will we know if that they weren't on South Street or in Rittenhouse Square, or that they've connected with residents that we should have a concern? Or is it just kind of like take the MLB's word for it that everybody is safe?
the fact of the matter is with contact tracing, you always end up just trusting the information you're given. People can be out there exposing folks and tell you and not tell you about that. That happens. It's not a perfect system. And I don't know that we have no evidence right now that this is any different there than elsewhere. That these players, they're at least supposed to have protocols where they're amongst themselves. I think that the Marlins need to look into how is it they affected each other. I'm much more concerned about the risk of that over the long term than I am the risk to Philadelphia residents over this one event.
So on this last point, and if I can get you, Dr. Farley and Mayor Kinney to jump in on this point, I guess for residents, you guys are saying, hey, if you go out of town or come back, you should self-quarantine. If you go out of town and you come back, you're going to be subject to contact tracing, but it kind of sounds like the Marlins and the Phillies are not subject to those same rules. Is it that these sports players get, better consideration when it comes to health than regular citizens?
Just to be clear, we're not saying that people go out of town and come back that we're going to be doing contact tracing. We just start with contact tracing if we have a positive case. We are recommending that people who come in from other places quarantine for 14 days. According to the protocols that we got from Major League Baseball, these people, the players, effectively were in quarantine. They were really separated off from everybody else during the time that they were here. If they get into this and they tell us that was different, then that's a problem. But they really did have, on paper, very strong safety protocols. I think, I'm going to guess that the players were together someplace in the clubhouse, in the bus, whatever, and were not wearing masks when they should have. To me, that's the greater issue than the contact tracing piece.
All right, thank you, Manny. Let's go now to Laura McChrystal of the.
Hi. I'm wondering, first of all, another question about the Marlins situation. Dr. Farley, I know you said they're working on the contact tracing. Are you aware if there's been any quarantine or testing suggested for even like staff at the hotel where the Marlins were staying?
I know that that's being looked into. I'm not aware of any of them that have been said, oh, yes, there was an exposure, therefore this person needs to go into quarantine. That may have occurred, but I'm not aware of it yet.
Okay. And a question on contact tracing more generally. I'm hoping to clarify, with this high number of cases, is your team actually attempting at least to contact every new case that comes in, or are they kind of only able to get to a portion?
So let me give you some numbers on that. I thought I might get that question. Some cases we have no phone number, and so they can't even attempt it. So 12% of the cases had no phone number. 10% of the cases were managed by partners. So the University of Pennsylvania is doing their own contact tracing, so they're managing that. We are trying to reach all the others. 8% we did not reach because they simply didn't have enough staff time to keep up with the flow. So we tried the very large majority.
Okay. And to clarify your advice about going to the Jersey Shore, now it's my understanding, correct me if I'm wrong, that New Jersey is not on the list of states that you're not recommending people go to or have to quarantine afterwards. Correct. You're simply recommending against beach trips.
Correct. And it's not knowing exactly what it is that's happening at the beach. We're just seeing a fairly high proportion of our cases saying that they had a beach trip. And based on that information, we're saying this is probably not a good idea.
Well, the other issue too is if you own a house at the shore and you leave your house in Philly and go to your house at the shore and stay in your house, that's not the same as going to a 150 person party, to a kegger on, in some bar somewhere or in somebody's house. There's multiple differences in people's experiences taking care of themselves and keeping themselves safe, or not.
Okay, thank you.
Thank you, Laura. We will move to Denise Clay of Philadelphia Sun.
Yes, my question concerns the testing with MLB. As you know, Toronto has said that the Blue Jays cannot play any of their games in Toronto due to the coronavirus. Is there any point where Philadelphia might consider something similar?
I know that people are concerned about the fact that we have 15 cases in baseball players, but let's remember that we're getting 164 cases in Philadelphia residents every day. And so the marginal risk to Philadelphia residents for this team that should be following fairly good protocols is pretty small. So I would say it's unlikely that I would want to prohibit the teams from coming to Philadelphia to play. Again, I'm more concerned about the safety procedures that they're using day in and day out to prevent spread amongst those team members.
Now, speaking of the cases that are happening in Philadelphia itself, is because there's a rise in cases, and you're seeing it so much that it's keeping us from going back to indoor dining on August 1st. Are there going to be any plans to kind of like reinforce the mask mandate? Because obviously, how it's being currently enforced isn't working.
Well, I disagree that it isn't working. So, our data shows that the large majority of Philadelphia residents are wearing masks when they're in stores or when they're at SEPTA. Not 100%. We want it to be higher than that. We have our media campaign that you see over my shoulder here with a constant reminder. We hope to boost that. And you may have heard that there was an analysis recently that showed that Philadelphia had the highest mask use of any major city they looked at to the extent they could tell in the study across the country. So I do think we're doing pretty well on masks. We need to do better still. But I don't think we're going to solve that problem by trying to arrest people who are not wearing masks.
Well, if we're not going to be a little more forceful with the mask mandate or anything else, how do we get this under control? Because obviously there's a disconnect between residents and what they should be doing for the virus if cases continue to go up.
Well, and first, let's remind people that this virus is not going to go away until we have a vaccine. It's always going to be here. There's going to be rises and falls. And we need to try to respond to the rises by understanding why it's spreading, where it's spreading, and then try to make our adjustments based upon that. We could try to shut everything down, but as we've seen, that's pretty tough on the society as a whole. But what we're seeing now is this is really being spread within families and at social events. And so we're making our recommendations today to try to limit exposure within families and in social events.
¿Cuántos casos debe reportar la ciudad de Filadelfia para que se vuelva a considerar y se implemente de manera inmediata un lockdown, como lo vimos al principio de la pandemia? Es mi primera pregunta. ¿Cuántos casos tienen que haber diarios para que volvamos a enfrentar la misma dificultad que, como acaba de decir Farley, tiene un impacto bien severo en la economía, la vida social de todos?
The question is, how many cases must the city be reporting for the city to reconsider having an immediate lockdown again, taking into account what Dr. Farley has said about the impact on the economy and on the social life in the city?
Yeah, I don't think I can give you an exact number. In part, that's because it's not just how many cases that are occurring, but also the rate at which they're changing. Back in March and April, when this epidemic first hit, the case rate was changing very rapidly. We saw more rapid changes in days than we're seeing in weeks right now. And that rise is quite dangerous. At the peak of our epidemic, also 40% of the people we were testing were positive, and now it's 5%. So we're a good bit lower than that. So I don't think we're close to a point where we're going to shut the entire city down again. However, we are going to look at things, and if we feel that cases are rising and that we find specific locations or settings where the virus is spreading, we can prevent through some sort of either regulatory action or through education, we will take that advantage. We're not looking at a broader shutdown right now.
No puedo proporcionar esta información respecto al número exacto de casos porque no solamente es relacionado con el número exacto de casos, sino las tasas bajo las cuales se dan estos cambios. Por ejemplo, en marzo y en abril, estos casos y estas tasas cambiando rápidamente en cuestión de días y ahora está sucediendo en cuestión de semanas. Entonces, las tasas daban un 40% de resultados positivos y ahora estamos alrededor del 5%. No estamos preparándonos para cerrar la ciudad en ningún momento en estos momentos, pero en caso de elevarse las tasas de infección, estamos preparados a resolver en lugares específicos y a través de regulaciones y educación, que es la manera en la cual estamos pensando hacerlo, pero no estamos pensando en cerrar la ciudad por el momento.
Segunda pregunta, parece haber una falta de confianza entre la comunidad hispana o minoría que no necesariamente entienden el inglés en cuanto al rastreo. ¿Cuál es el mensaje a las familias una vez reciben esta llamada de una persona que está tratando de rastrear los contactos luego de que se haya reportado a alguien positivo al COVID-19?
My second question has to deal with contact tracing. And there seems to be a lack of trust within the Hispanic community or minority communities about contact tracing. What is the message that you would have for them and their families once they receive a call from someone they don't know and they want to get to trace infections?
There's a lot of people have a distrust in government these days. That's part of why we put the video on our website so you can see the sort of people who we have hiring doing this work. And we simply are trying to get the message out to everyone that there's no downside to this participating. It's just helping your fellow Philadelphia resident, who may be your relative and maybe your friends, helping them avoid getting the infection that you have or that you might be exposed to. We don't collect any information on immigration status. We never report any information to the immigration authorities. And so we need to continue to get that message out. Again, if you look at our website and see what our process is, and you see the sort of people doing our work, I think many people would be much more trusting in that process.
Entendemos que mucha gente tiene desconfianza del gobierno, por eso hemos puesto un video que muestra a la gente que hace este seguimiento, tratamiento de contactos. Y nosotros tenemos un mensaje que es que no hay nada negativo en querer ayudar a sus conciudadanos de Filadelfia para evitar que ellos se infecten como se infectó la persona. Nosotros no estamos ni recolectando ni transfiriendo información con respecto a estatus migratorio y nosotros vamos a continuar transmitiendo este mensaje, alentando a la gente a que visite nuestro sitio web y que vean cómo se desarrolla el proceso y cuáles son las personas que lo hacen para que puedan desarrollar un poco más de confianza en nuestro sistema. Gracias.
This question is for Dr. Farley. You mentioned earlier that in some of the cases, 12% you were not able to have contact those who were tested positive for COVID. Would you suggest anyone to do anything specific who does become positive for COVID so that they can be entered into the contact tracing database?
Well, if they, when you go to a test site, they should be collecting your phone number. And so make sure you use the right phone number there so that we get that. And then we get that information off the laboratory reports. So that's probably number one. And the second is a bigger issue. When the phone rings, pick it up. We all get robocalls. We're trying to avoid that. There is information on our website of the exchanges that our contact tracing staff will be using, so that you can look for that number. If you see that number, it's the health department calling. They actually say health department on that. So if you get a call from the health department, pick it up and talk to those folks.
And my second question, also for maybe Dr. Farley or Bryant. This weekend, there were some number of reports at different parks of park officers or officers being dispatched to really tell people to put their mask on or to talk about the trash that they're leaving there. And predominantly, most of the people were not from Philadelphia. As this gets, if you see the cases increase, will you start to put more signs up at our parks to alert folks to wear masks and to not leave this huge pile of trash in Philadelphia?
So I think we've put up a number of signs throughout our park system. We're going to continue to evaluate that signage and whether we need more or additional. And as I said a couple of weeks ago, we have asked a number of our rangers to be social distance ambassadors, and certainly trash is a piece of that as well. So that work's going to continue.
Thank you.
Thank you, Martin. Let's go now to Pat Loeb of KYW.
Thank you. I was just looking at the list of states the mayor mentioned, and it appears to be different from the list that the state has put out of states to avoid travel to or quarantine when returning from. Is there coordination at the state level on putting that list together?
Our criteria are very similar, but we haven't coordinated. I think, we may update on different days of the week and our threshold may be slightly different. We did this first and that came in later. We haven't changed, but I think it's, for most people, it's going to be the same.
Okay, thank you.
My question is for Dr. Farley and for Mayor Jim Kenney. What was your guys' initial reaction when you heard that the Marlins players tested positive but still decided to play the game on Sunday?
I don't know the full story there. I certainly was disappointed. They have their safety protocols and they need to follow those protocols. If they don't, they're going to expose each other. I say most baseball players tend to be young and healthy. Most of them will probably do fine. But the more that are affected, the more likely they're going to spread to others. So they need to follow their protocols.
Just concerned about their health and hopefully they get through it and don't spread it around to anyone else and don't have debilitating issues relative to the disease progression.